Hello, my name is Dr. Emma Craythorne. I'm a consultant dermatologist and dermatological surgeon here at the London Scar Clinic at 152 Harley Street. I trained at the St John's Institute of Dermatology at Guy's and St Thomas's Hospital, which is where I currently work with my NHS practice, seeing patients with skin cancers and treating patients with scars. I can help you here at 152 Harley Street with all aspects of skin cancer and with severe scarring. We have a number of techniques here at the London Scar Clinic at 152 Harley Street that can improve the appearance of your scar. We can never say that we can get rid of a scar completely because that can't really happen, but we can certainly make scars look much better by improving the contour of the scar, hiding the scar within the natural skin lines and reorientating it, and improving the feel and the texture of a scar. In the patient that we're going to see today, he's had a shingles infection of his forehead, and that shingles infection has resulted in him having deep atrophic scars. So these are scars that are sunken into the skin. He also has a textural change over the surface of the skin that's resulted in some changes in the colour of the skin and the texture. So what we plan to do today is, using the UltraPulse carbon dioxide fractionated laser, is to improve the contour and texture of his skin. The UltraPulse carbon dioxide laser is the laser that we use at the London Scar Clinic. This is a very specialised laser in the sense that the UltraPulse means that it delivers a high amount of energy to a specific point within the skin. But in delivering that high energy, it reduces the amount of side effects that come nearby it. So the energy is delivered quickly and efficiently. And that is important because what we want to do is deliver energy to a specific point so that we can restructure the shape of the skin. And the UltraPulse CO2 laser is the only one that will be able to deliver it specifically. The other important factor with the UltraPulse laser is it's fractionated. This means that the beam is split up, which allows areas of normal skin to remain, and it improves wound healing. So in having the energy delivered in this way, it reduces your side effects and you heal much more quickly. Once the patient has had the treatment today, there are a number of very important things that they have to do. First of all, the patient has to look after the wound very carefully. So they will wash the wound at home, they will be careful to pat the wound and not rub it dry with a towel, and then they will apply a clean layer of Vaseline over the surface for the next 5 days. It's very important that they don't expose their skin to the sunshine. If you expose your skin to the sunshine, you increase your risk of developing brown patches within the healing area. So these are two very important factors that have to be considered. Also, you will be given a telephone number, and if you're concerned at all about any chance of infection or the wound not healing properly, you can call that telephone number so that we can see you urgently. The main thing that we need to avoid is infection within the wound that we give you, because infection will result in a poor outcome and you're more likely to scar as a consequence of infection. Infection happens very rarely, probably in about less than 1% of cases using this technique, but because the consequences of it can be very important, we need to know early on if you're potentially at risk from that. We have an excellent team of nurses here who are well trained in the use of lasers and the follow-up care of patients who have had laser treatment. So they're always at the end of the telephone if you need advice, or here to see you should you need to come in.